It's a pleasure to be here, and before I kick off, I'd also like to acknowledge the traditional owners of the land we meet on today, the Noonkanoo people, and pay my respects to their elders past and present, and any Aboriginal or Torres Strait Islander people who may be here today. So thank you very much for that kind and welcoming intro. It's always a pleasure to be able to, and a privilege to be able to return to Port Pirie, not only to visit my family who are still here, but to come here for work, which I've always been fortunate to do in my career to date. So thank you for having me. As Alan mentioned, today is a really significant event, and even more so because the idea of how this event has come to fruition is because it was born out of the idea and voice of a carer, Jerry Shibble, mentioning that there was more of a need to be having this conversation about carers in the community, not only in Port Pirie but surrounds. And there certainly is a lot more conversation to be had and discussion, not only from carers in the community, but also government, non-government organisation and other peak bodies, to be able to ensure that we continue to improve on the services, supports and information that are available for carers. And I'm here to talk on behalf of Carers SA. We have been around for over 30 years, but our role in supporting carers has changed. So it's timely that this event has come about today. So today we thought it would be good for this session, for me to kick off, to talk about firstly who we consider as a carer, and also to talk about what our role at Carers SA is in supporting carers, which is available here for carers in the community, to talk through the Carer Gateway, which has only been around for just over a year, and it is the new federal government's service for carers around the country, and also to talk through how carers and organisations can access the services that we offer. So firstly, anyone, anytime can become a carer. In fact, almost 2.65 million Australians are carers right now, which equates to about 1 in 8 people. Carers make up nearly 11% of the Australian population, and over 235,000 carers are under the age of 25 across the country, which is significant. And young carers can range from primary school age kids right up to early adulthood. Unpaid carers, so carers who are unpaid, is what Carers SA consider our clients and the people we support, provide an estimated 1.9 billion hours of care every year, which saves the Australian government $77.9 billion annually, which Alan also referred to. That is significant. So carers, the unpaid carer community in Australia, essentially are the foundations supporting and contributing such a significant role in their caring support to the person or people they're caring for. So you can imagine if carers weren't there providing this layer of support, what that would mean for the government, for health, for mental health supports, for the economy. So without carers providing that significant amount of support, what would happen to the people they're caring for, and also to the government and health systems? In South Australia, we know of 245,000 unpaid carers. But we know that there are more than that, and there are a lot of people who don't identify as a carer, and there may be people here today in the audience who don't identify as a carer but may after today. And they may not identify as a carer because the term carer doesn't match their role, what they're doing every day. Or it may be because of cultural reasons. A lot of cultures we know are taking on a caring role because it's what we do. So if grandmother had a stroke, or a niece or nephew had a disability, or other people needed support, of course those people I would care and support them, but I wouldn't see myself necessarily as a carer. So a carer can mean lots of things to different people, and that may be why sometimes people don't identify as a carer and therefore don't seek supports. But of those that do recognise and identify themselves as a carer in our state, we know there's about 245,000, which includes just over 30,000 young carers aged between 7 and 25 years of age. So who is a carer? So you are a carer if you provide unpaid care to a family member or friend who may have a disability, a mental illness, dementia, which could be early onset as well as in older age. You could be caring for someone with a long-term health condition, an illness that may be terminal, someone who may have an alcohol or drug-related problem, or someone who is frail due to age. So it's so broad. You may be providing full-time care for someone, you may be providing part-time care. You may be living with the person you're caring for, you may not be. You may be caring for a neighbour. It could be someone who is, you may have more than one carer in the one household caring for one person. You may be caring for more than one person. You may be caring for people of all different ages. So it is quite broad. And after these presentations, we often have people in the crowd say, well, actually, I'm a carer. That fits who I am. Or I actually know other people in my family or friends who actually would be a carer, but they may not be aware of that. So it is quite broad. And if you are a carer who is looking after someone or supporting someone who may have one of these conditions, it needs to be 6 months or more. So if my partner was to break his leg tomorrow, I wouldn't be deemed eligible for services. But if someone who has one of these conditions or illnesses, which would be more prolonged, 6 months or more, then that's who we deem would be eligible for our services and supports. The only one that wouldn't be is someone who may be in palliative care, because as we know, someone who is in palliative care may be in palliative care for quite a short time or a longer period of time. Some common questions we get asked around eligibility for our services. Can I access Carers SA and the Carer Gateway if I'm accessing NDIS? Yes, you can. Whether people are connected with NDIS or, in fact, My Aged Care, you can connect with us at Carers SA. So you're eligible, as long as you're caring for some of the caring for someone who has one of the conditions I mentioned in the previous slide. So we're there to complement. Can I receive the Centrelink carer payments as well as access services through Carers SA? Yes, you can. In fact, a lot of the carers we connect and support with may not have a carer allowance or a Centrelink payment. You are very welcome and eligible to connect with us if you do or you do not. It is not income or means tested. Do I need to live with a person or people I care for to be eligible? No, you don't. You may live with a person, you may not. In fact, a lot of people who we have connected with quite recently and have run some of these sessions with are people who may be caring for elderly parents. So you may not live with mum or dad, but your parents may be ageing. You may be working, you may not be, but you're the go-to if something happens for mum or dad or both of them who may be frail. You need to drop things, to take them to medical appointments, check on them daily, be the person who's navigating My Aged Care or whatever it might be with Centrelink. So you are considered a carer also. And a lot of people in that cohort don't necessarily realise they are, as well as those who are providing care 24/7. So who is Carers SA? So we have been around for over 30 years. We're a non-government organisation, and we've been providing support services and information to the carer community for over 30 years. In April last year, our role changed and it grew. We became a statewide organisation as of April last year, and we now are the key lead agency for supporting carers in South Australia. And we are now the local carer gateway provider on behalf of Australian government. So we have staff spread throughout all states and territories, throughout the state, and there are also other carer gateway providers who are the lead agencies in other states and territories. So in our state, Carers SA is the lead agency. The Carer Gateway is a large part of what we do at Carers SA, which we took on in April last year as a new role, but we're also a key advocate for carers. So as the Mayor was saying earlier, the Port Pirie Regional Council are a key advocate. We are also in relation to carers. So we listen and hear and want to keep hearing what the carer voice is telling us collectively and individually, like how this event has been born out of those conversations around we need to be doing more for carers in this community. We are also considered a statewide organisation where we want to keep hearing your views, raising them with government, raising them with peak bodies to ensure that carers are getting the help and support that they need and deserve. So what is the Carer Gateway? So the Carer Gateway, as I mentioned, was launched nationally in April last year. There are services available through the Gateway which can be delivered online, in person and via the phone. So we know that online isn't everyone's cup of tea, but there's more and more online technology and connection and services, particularly in this day and age, and as we've seen over the last year with COVID. But there's always a place and an important role of having face-to-face services and connection. It doesn't matter where you live in Australia. If you are a carer, you have access to the Carer Gateway. which is why it is a federal Australian government service. In SA, as I mentioned, we are the gateway provider for South Australia. So some of the gateway services that are offered, to kickstart the process, carers would contact us, or you could be referred by an organisation to connect with us, and we would have a conversation with you over the phone at a time that suits you to understand and learn more about your caring role. What's working well? Where do you need some extra supports? And from that conversation, that then helps us to better understand where we can put some supports in place with agreement with you as the carer. So after that conversation, carers may have access to this particular service, which is what we call carer-directed support services. But in a nutshell, it is where a carer may have access to a carer-directed package. And packages consist of a range of things individualised to the carer need. And that could be one-off practical support to help the carer in their caring role. It could be an item that we purchase on your behalf that will help you in your caring role. It could be things like white goods, where that you might not have the means to purchase or replace white goods that are breaking down in the home. It could be a laptop, which helps you to stay connected potentially with your work and volunteering or social connection. It could be a whole range of things. It could be a physical health equipment item. So you may not, for example, be able to have that walk every hour that you may have done every day, but because of the person you're caring for now at home, you can't have that break, which was your 1 hour a day or 1 hour every couple of days for you to connect and just have time out. But to have maybe a physical equipment at home, to have, whether it could be the weights or treadmill, whatever it may be, that could be something that we could offer. Again, it's very dependent on your needs as an individual, and these are just some examples I'm giving. It would come back to what that means for you as the individual in that conversation. Another package we could offer, if the carer's situation would benefit from a longer series of planned supports, this is where planned respite could be offered. It could be in-home, out-of-home respite. It could be things like gardening support. It could be cleaning in the house. It could be assistance with transport. It's very varied. We've even been able to provide support for young carers to get their driver's licence, for instance, which we know can be a cost. It's about taking that pressure off and providing some of that support, where a carer might say that really takes the pressure off and is a real support for me at this point in time. So it could be a series of supports, again, depending on the needs of the carer. Another service we may be able to offer is counselling. So counselling can be offered one-on-one with a carer, a professional counsellor, and the counselling is available for carers who may be experiencing some challenges with their own mental health. We know, and the Carer Voice tells us through the research and data and surveys that have been done, that often the mental health and the well-being of carers is often of decline because of their caring role, because of their caring situation. So it's so important that where carers are supported, which is what the Carer Gateway aims to do, the more supported, the more resilient, the more connected a carer is, particularly when they need us most, then that has a flow-on effect to the people they care for. Carers SA can offer up to 6 counselling sessions for carers, and sessions are available across South Australia, as are all of our services. Another service we can offer and support is peer support. So where carers can come together in their local community, they can connect with other carers. It's a social connection opportunity, but it's also about covering off on, at each session, a series of topics that aim to come back to who you are as a carer. Often as a carer, you may lose sight of what was once important to you or your connections, whether it be with other family members, hobbies, interests, passions, friendships in the community. And the things we cover off on these discussions in these peer groups is about how you can reconnect about what is important to you as a person. So take the carer hat off, which is often hard to do, but come back to you. What is it about you, about reconnecting back to what is important to you, as well as being a carer? And then we start to have conversations about what that could look like, as well as connecting with other carers. We also run these peer groups online as well via Zoom for those that are able to do that and like to do that. Coaching is another service carers may be eligible for, where carers can work one-on-one with a person who supports them in a coaching role. The carer identifies for them a goal that's important for them that they'd like to bring about change in their life, and the carer's SA person would work alongside the carer to support them, not do on behalf of, but help the carer to navigate to create change in their life, or to work through that goal that the carer's identified as this would really help me in my life with a little bit of support. And there are up to 6 coaching sessions that can be offered to carers with that service. Emergency respite is a key service we can offer to carers. Emergency respite is where a carer may have access to respite at short notice. So this is when there's an emergency or unplanned event that occurs. It's not only when people often think that this is only available for when instances where a carer may end up in hospital in an emergency situation. That could be one example. But it could also be where the situation at home becomes unsafe for whatever reason. It may be that the person you're caring for situation, from time to time, it would benefit from having some space. So it could be a whole range of reasons that are unplanned or an emergency situation, where we may be able to provide that emergency respite support in or out of home, depending on the person's situation and availability of respite care. We also do run the Carer Gateway service in partnership with other organisations you may be aware of or have heard of or even access support from. So that's Life Without Barriers, it is Skylight Mental Health, Dementia Australia and NPY Women's Council, as well as a whole range of culturally and linguistically diverse community groups across South Australia who are helping us to connect with carers who come from different cultural backgrounds. The Carer Gateway services, in addition to what I've described, that Carers SA and our partners are able to deliver and connect with carers on, there's also a website, the Carer Gateway website, for those carers who want to access information and supports in their own time, in their own leisure, and do it via this if you have the connections to do that. So that's also available to you. Other services we are able to offer, and we do have a table over here. You're welcome to take information which covers off on this in more detail, but there is a program we offer also called the 5 Ways to Wellbeing, and that program is focused on mental health and wellbeing for carers. There are workshops run throughout the state and they're regularly promoted, and it's where carers can come together to hear about some really practical supports. They're fun and engaging, but also about some practical, cost-effective ways, in fact they're free ways, to be able to top up our mental health, our toolkit up here. It's not only about physical exercise to keep our wellbeing going as carers, but it's also about our mental health and wellbeing. So those sessions are run regularly. And another one is called Your Caring Way. Your Caring Way is a service and support available to carers specifically who are looking to re-enter the workforce, or maybe not for the first time, but it could be for the first time. We know that carers may have a long time out of their working life, and when they do want to re-enter the workforce, the confidence may be a bit low, they may not know where to start, and we are able to offer a specialised service purely for carers who want to reconnect with the workforce or look at work, volunteering or education, and we have employers from a whole range of sectors who are signed up to this, where we're able to connect carers once they've gone through a bit of vocational coaching or support from us to then connect with potential employers, which is really great. And we also play a lead advocacy role, as I mentioned earlier. So where to from here? We wanted this presentation to be able to set the scene about who is a carer. The other presentations are going to go into a bit more about vocational educational supports that you may be able to access as well. But this is really to give you an overarching view about who is a carer, the number of carers that are in our state as well as nationally, and the significant role you play. And for the carers in the room, I take my hat off to you, because it is a huge role, and the caring role might look different for everybody, but we want to reassure you through today, if you weren't aware of us or you weren't aware of how the extent of our organisation or the Carer Gateway services available to you, that these are available to you if you choose to connect with us. So I encourage you to talk to your colleagues if you're here representing an organisation, friends, neighbours and others who may be a carer, and promote the services that you may be able to access. And there's some ways you can access us. In order to access the services too, you do need to register, with the exception of emergency respite. And there's forms on the table over here today. You're more than welcome to fill those out, post them in, or you can register on our website. But I'll be available throughout the next couple of hours if you wanted to ask any questions or have a chat. Thank you very much.